A neglected menstrual period is frequently the primary recognizable sign of a probable being pregnant. However, there are other signs and symptoms of early being pregnant as properly. Not all women have all signs and symptoms or experience them in the same manner. The primary sign many women apprehend as an early sign of pregnancy is a neglected menstrual period. A few women may revel in lighter than normal intervals, and they may also have recognizing that could arise 1 to 2 weeks following thought. A neglected menstrual period can be resulting from other conditions other than pregnancy. Breast growth, tenderness, or ache similar to premenstrual symptoms can arise early on at some point of pregnancy. The breasts might also sense complete or heavy, and the vicinity across the nipple may also darken. A dark line known as the linea nigra that runs from the center of the stomach to the pubic area may seem. Nausea and vomiting that generally happens in the morning in early pregnancy commonly occurs among weeks 2 and 8 of being pregnant. It is a misnomer due to the fact the nausea and vomiting can truly show up at any time. Every other early pregnancy sign can be meals cravings or aversions. Women may have an uncommon urge to consume a selected food, even one she formerly did not like. The extra progesterone in a woman's body in the course of pregnancy may purpose her to feel fatigued and worn out, and the want for naps increases. Through the second trimester, energy levels typically rise again. The rise in progesterone in the course of being pregnant also can purpose stomach bloating, fullness, and gas. The weight gain in the first trimester is generally minimum, however cramping and bloating can also make you sense as when you have received more than the typical 1 pound per month. The urge to urinate more often begins approximately 6 weeks into pregnancy. The hormone human chorionic gonadotrophin, which causes improved blood flow to the pelvic region and might stimulate the urge to urinate. Later in pregnancy, the urge to urinate can be extended through the developing baby inside the enlarging uterus, putting stress on the bladder. Many women hoping for become pregnant will chart their basal body temperature, the lowest body temperature in a 24-hour duration, generally first thing within the morning after waking. The basal body temperature typically rises around ovulation and lasts until the following menstrual period. If the basal body temperature remains high for longer than that, it can indicate being pregnant. Throughout the first trimester, the pores and skin on the forehead, bridge of the nostril, top lip, or cheekbones may darken. It's regularly known as the mask of being pregnant, and the scientific term is melasma or chloasma. It is more common in darker-skinned women and those with a family records of melasma. Rapid adjustments in hormone stages at some point of pregnancy may be liable for mood swings and feelings of pressure. Women might also feel very emotional, anxious, or depressed, and have crying spells. Mood swings may be worst in the first trimester, easing up truly within the second, and coming back because their pregnancy nears the stop.